Namaskar. I am Dr. Ramani, founder and managing trustee of Sankara Eye Hospitals, India. I would like to share with you the 40 years of Sankara Eye Care. It was in the year 1977 when we started the movement. We strongly felt that health is a fundamental human right and it is an attainable social goal. Both myself and my wife, Dr. Radha, we were inspired by the Kanchi Shankaracharyas, who are trying to tell that doctors also should spare little bit of their time for the less privileged. So we started a small little primary health care in the heart of the city with 10 more doctors, all of us in our mid-20s and late 20s joining together. And this primary health care grew from strength to strength, and the number of doctors who were in the team became 75, 5 from every specialty of medicine. On top of it, the various industrial groups of Coimbatore approached us and said that they would like to have a similar medical center. So we established 9 such medical centers around the city of Coimbatore, and all put together we are handling 1,000 patients, providing them with basic primary health care. Later, after 7 years, we strongly realized, we felt that eye care is an area where a lot more can be done, because primary health care, government of Tamil Nadu was doing a lot of work, both urban and rural areas. So we thought, let us take a specialty, and we chose eye care. We chose eye care because of 2 reasons. One, there is a huge need for eye care in our country. 1/3 of the world's blind live in India. 12 million are totally blind. 45 million are visually handicapped. The irony is, 80% of them, they don't have to be blind at all. They are needlessly blind, either preventable or curable. Non-availability, non-affordability, inaccessibility of quality eye care, especially in rural India, make many of them live in darkness. So we said we'll take up eye care, and my neighbor, Mr. Nataraj and family, they came forward to donate a huge piece of land, 5.5 acres on Sati Road, where with the support from the community in Coimbatore, our own chairman, Mr. S.V. Balasubramaniam, and every single family coming forward and saying that we would like to be a part of this mission for vision, we built the hospital in stages. On this piece of land, with every family in Coimbatore coming forward and putting forth either a waiting hall or a rooms or theatre, today we have a 500-bed super speciality eye hospital at Sankara on Sati Road. We had specific goals for Sankara. The first one was eye banking, Sankara Eye Bank. In the year 85, we started that when there was no eye banking in South India at all, and we took it up as a challenge and went to the community. Glad to tell you that today we are one of the model eye banks in the country, receiving a pair of eyes every day. Not a day passes without getting a pair of eyes as donation. And this transplant happens to almost everybody from every community, cutting across all barriers. So that is Sankara Eye Banking. The second goal, Gift a Vision. Along with Rotary Coimbatore Central, we started Gift a Vision program, where we said, let us go to the village and provide quality eye care at the doorsteps of rural India. And we identify the poor people, bring them, admit them, investigate them, provide them with the best of surgery, phaco surgery, with medicines and food, everything free. By the grace of God and the blessings of the Acharyas, since 30 years, we have not missed a single Saturday, Sunday. Over 4.5 million patients have been seen, examined, and over 1.5 million free eye surgeries have been performed. Presently, we are performing 500 free eye surgeries every day. Third program is preventive eye care for children, titled Rainbow, where we have screened close to around 5.5 million patients. Diabetic retinopathy for rural India is yet another program. Sankara is unique in the sense we work on an 80-20 model, where 80% are the free patients and the 20% of the beneficiaries, the rich and the affluent, the affordable section, they pay for the treatment, thereby cross-subsidize. It's a super specialty services, comprehensive with all specialties available. Our Silver Jubilee program titled Vande Mataram, wherein we said let us share our experience for the benefit of every state in India. Today we have 10 hospitals in different states, and the next 4 are coming up in Rajasthan in Jaipur, Indore in Madhya Pradesh, Hyderabad for Telangana, and Mumbai for Maharashtra. God willing, we want every state in India to have a Sankara Eye Hospital. When we said we'll celebrate 40 years is not a short period, especially for a charitable activity, and the name Netra Yajna was given by none other than our own Honorable Prime Minister. So this is being celebrated throughout the year as a Netra Yajna. And new hospitals. Right now, Sankara as a group, we have touched 1 crore lives in India. We are looking at, when we spread across to the various hospitals, at least over the next few years, around 3 crore lives would be touched across India. Sharing our experience and expertise, we are around 1,800 people working in Sankara with 2,000 bed strengths across the country. Sankara, there is no attrition. People have been working with us for 10, 15, 20, 25 years. They continue to work and grow as a family member of Sankara. So we are proud of our human resource. We have a clear organizational structure and a strong second line which is taking the institution forward. We have brought in process and systems. Replication is not an easy process, so we brought in a lot of process and systems in administration as much any of the established corporates would do. Friends, vision is the gift of God to behold the beauty of nature. Whatever may be the cause, to be blind is not fair if it can be either prevented or cured by quality eye care. Sankara strongly believes that everyone in the community should have good vision. Whether the person is very poor from the village who can't afford, he should get a totally free eye surgery. The middle income and the rich, the affordable sections, they also should have a very good vision. So for them, services at affordable cost. So when 20% of the people who pay, the beneficiaries, it supports 80% of the free patients. So it is a replicable and a sustainable model in community eye care. Friends, I conclude with the golden words of Tagore, which has always impressed me. Tagore in Gitanjali says, "Where the head is held high, where the mind is without fear, where the knowledge is free, where the words come from the depth of truth, where the world is not broken down by narrow domestic walls, into that heaven of freedom, my Father, let my country awake." Being in Coimbatore, I know about Covai Post and the excellent work that is being done. Information has to be disseminated. Good and positive examples have to be shown as an example, as role models. Covai Post is doing a great job, and all the viewers of Covai Post, may I convey my best wishes on this happy occasion of Netra Yajna, and take this opportunity to invite every one of you. Please visit Sankara Eye Hospital as and when you can. Best wishes and sincere thanks to Covai Post. Namaskar.